Hi, this is Kelly Ott.
And I'm Lara Wakefield.
And today on Focus Point, we're going to be talking about our graduate training in writing goals.
Which was many, many years ago in the dinosaur ages, right?
Yeah, when we had to sweep out the cave. And
right. We actually had to handwrite things on carbon paper to get copies, right?
Right.
So long ago, I was reminiscing with Kelly because we went to graduate school together at the University of Missouri.
We did.
And I was telling her a secret about myself and what I went through. And I confessed, true confession time, that I had never written my own goal. I never wrote a goal in graduate school. And then when I went and did my CFY, which is it's like a clinical practice year after you graduate with your degree in speech language pathology. During that time, I never wrote a goal either.
How did you get through your clinical fellowship year, which is like a residency program for speech language pathologists, under close supervision, mind you,
at a high
to become certified?
Right.
How did you go through that whole year without ever writing a goal?
And I was at a high-powered rehab hospital with 4 great supervisors. So it wasn't because I was neglected or something.
Wow.
I had a wonderful experience, wonderful training experience. Here's what happened. So let's go back a little in time. When you're in graduate school, you do clinicals, and that's where you practice doing therapy with different populations, and you're supervised very closely. Well, during that time, you get a client, you have a little file, a little profile on them. They had been evaluated, and they come to you with goals already, in their file. So these, the ones I had in my clinicals already had goals. They were already there. All I had to do was the therapy and data tracking, which was extremely important. That's what I was there to learn. Then when I went to my hospital clinical at the VA, the goals were already done. They were already in the charts for the patients. I just, again, had to do the therapy to address the goals and collect the data. And these patients were already in process, so to speak. I never had to get a new patient and start from scratch. And then when I went to my school practicum, the students already had IEPs. They already had goals in place. And again, I was just collecting the data. And I, again, had a great supervisor, but I never had to write a goal independently. I realized I was 5 years into the practice of being a therapist before I ever had to write my first goal.
Oh, gosh.
From scratch, like initially really problem solving through thinking to write a goal.
Well, in contrast, I remember in grad school also not having to write goals, but my first clinical practicum outside of school, postgraduate, my CFY, I was in a nursing home, and my supervisor was not on site, so I was kind of thrown to the wolves, really. I had to just kind of go back and look at other care plans and kind of get an idea. And then once a month, my supervisor would come and review all my documentation if she came once a month, because she was like 2 hours away. And basically, her review of documentation wasn't related to the therapy I was providing. It was related to funding and reimbursement. So I had to make sure that I hit all the highlights in my documentation to make sure that that claim didn't get kicked back from Medicare or Medicaid. So that was my first learning opportunity. But, really, a lot of the mandates related to goal writing are the same.
Right, across many settings.
They really are. Now, maybe the relevancy is different. The outcomes are always the main relevant piece, but outcomes towards what? It's different. The school is your outcomes towards some academic or functional skill that is developmentally achieved. In an adult acquired situation where you're in a hospital or a nursing home, it's functional skills to regain what was lost. So the functional outcomes really are different, but it's still one of the main mandates is that you have to look or relate whatever you're doing in your goals back to those functional outcomes.
And it's interesting what you said. One of your strategies was to look back at what the other therapists had done. And so you could kind of copy and paste a little bit and just have a framework, but you were going off what these other therapists had done.
Not always the best thing to do because it depends on who was there before you.
And I have to admit, I did the same thing. So when I faced that first moment of writing that first goal on my own, I did the same thing. I went back and looked at other IEPs because at that point I was in a school setting. And I looked back at something and just kind of, tweaked it a little bit to fit the student I was writing it for and did that. But I think we make a lot of assumptions when we go back and use something that someone else did. We are assuming that they knew what they were doing.
Right. So I guess I'm curious, what were your experiences? Did you receive formal training on writing goals in graduate school or after graduate school? Did you receive any practical experience in your practicums or in your first jobs post-graduation? Let us know. Can't wait to hear how you learned to write goals.